Hi everyone. I'd like to begin by acknowledging the traditional owners of the land on which we meet today and pay my respects to elders past, present, and emerging. I'm Ray. I'm an MNHS student here at Monash. And today I'm chatting to some of our paramedicine, physiotherapy, and occupational therapy students to find out a little bit more about their degrees and what it's like to study at Monash. With us today, we have Maisie Sadler, who is studying a Bachelor of Paramedicine, Jessica Thompson, who is undertaking a Bachelor of Physiotherapy Honours, and Amelia Swan, who is completing a Bachelor of Occupational Therapy Honours. I'll now invite each of our students to please introduce yourselves and give us an overview of your degree and study experience here at Monash. Maisie, can we please start with you?
Yeah, for sure. So my name is Maisie. I'm currently in my second year studying at Monash University, and I'm studying a Bachelor of Paramedicine down at the Peninsula campus. I chose Monash a few years ago because I always knew that I wanted to be a paramedic. There was one day when I was really young, and I remember sitting in the paramedic van because we were taking a family friend to hospital, and I was like, this is what I want to do. And I was really drawn to Monash because I was researching a lot and I realized, oh, they're in the top 100 universities in the world. So I was immediately drawn to that. But on some further investigation of what studying at Monash would really be like, I was really blown away with the kind of staff that Monash employ, especially within the paramedicine degree. In the past, I've had countless opportunities to learn from paramedics all over the world and all over Victoria, and they've really shared their more personal experiences in the degree, which has been really well. I've really received it quite well, and it's been a really good learning experience. Also, I personally had a friend that studied at Monash, and now she's over in the UK working as a paramedic, and she kept telling me when I was in year 12, you have to study at Monash, it's the best place to go. I was like, okay, and then I finally put it down on my VTAC application, and I'm so happy that I did. I definitely found practicing scenarios at Monash to be the best part about the degree. It really makes you feel like a paramedic. You put your little uniform on and you feel like an actual paramedic because the dummy's lying there and they're like, he has chest pain, what do you do? I'm like, okay, I'm onto it. And I really have found that the best learning experience at Monash. Down at Peninsula as well, I find that campus amazing. There's a dedicated paramedicine building, so you're always with paramedics, and you always have things that, like, the dummies are always there to practice on. Every piece of equipment that you could find in the AV trucks, Ambulance Victoria trucks, are at Monash campus, which has been incredible. And the best part about the course I've found so far, other than practicing scenarios, has been going on the placements. And Monash picked the placements for you, but I've been lucky enough to be able to go on placements that are really close to my home. So that's been an amazing opportunity. And sometimes I've even been able to run some cases with the paramedics that I've been with. So all in all, I love Monash and I've been really happy with the degree that I'm studying so far. Even though there are some challenges, I've had all of the staff and the students been able to help me through those challenges. So yeah.
Awesome. Thank you, Maisie. Jessica, can we move on to you?
Certainly. So my name's Jess. I'm studying physio at Monash University, also at the Peninsula campus. I chose to study physio because when I was in year 10, I did work experience at my local hospital in physio. And from that moment, I just decided that I had to do physio. And I'm so glad that I did because it's been absolutely awesome. Originally, I'm from rural Victoria or regional Victoria in Sales. So moving away from home was probably the biggest challenge with going to uni. But when I got to the Peninsula campus, I realised that, everyone was really lovely and the students were also friendly. And the staff, the best part about the course, aside from, the content, is the fact that all the staff were so friendly and always happy to have a chat, and they know you by name rather than a number in a system, which was just absolutely the best thing ever. So yeah, I chose to study at Monash because the staff and the attitudes of all the people at the open day I attended just absolutely drew me in, and it just seemed like the place that I wanted to be. Apart from that, the thing that I love most about the degree is the fact that there's a really good mix of hands-on stuff in the pracs as well as theory with lectures and things. So it wasn't all learning from the books. It was, like Macy said, you're in doing things that are applicable to your degree, like learning physiotherapy techniques that when you go out on placement become very applicable. And I'm actually on placement now, which is the best thing ever. The uni and the course really prepares you well for the situations you're thrown at with such a broad spectrum of situations. So just really good preparation to go out in that, and it's been really enjoyable. The other things that at the uni that I've been involved with, for instance, you've got uni games that you can go in and join in on, and there's so many social sports you can play with, like netball and soccer, and they're also a really good way to meet friends, and just not even people from your course, but people from different courses. So there's a really good academic life at Peninsula campus with your course, but also really good social life with sports and different events and things like bowls and camps that you go on with friends, which makes it so much more than just learning. So yeah, that's probably my wrap up of physio. So 100% absolutely enjoy it, and yeah, if you're thinking about doing it, then definitely something to consider.
Awesome. Thanks for that, Jess. Amelia, can we move on to you, please?
Yep. So I'm studying a Bachelor of Occupational Therapy honours, and I'm in third year at the moment. So I chose Monash because it was one of only a few OT degrees in Melbourne that has honours attached, and everyone in the cohort graduates with honours. And Monash is also like quite prestigious in terms of universities in Victoria, so that's kind of why I chose Monash. I love that OT is so varied in the topics that we learn about and how hands-on it is. So it's like a biopsychosocial course, meaning that you not only learn anatomy and physiology, but also psychology, population health science, and occupational science. So if you love like a whole range of sciences and what makes up a human, then OT is for you. And as OT is quite a small course, my year's only 120 people, you get to know everyone over your time at uni. One of my favourite times in the year at uni is near the end of the year when the OT Society has a uni ball and everyone gets dressed up and you go to a really nice venue and have dinner and dance, and it just brings the whole kind of cohort together as a group. I also love Peninsula campus. It's really easy to navigate considering it's smaller than like Clayton or Caulfield, but it makes it less overwhelming than those other bigger campuses. And yeah, it's just, I love like, you know, hanging around on like the Mornington Peninsula. I think it's just kind of more a bit zen than like near the city or whatever. One of the best things about doing OT is the placement. And currently I'm not on placement at the moment because of coronavirus, but in my second year I got to go on an amazing placement at a rehab hospital, and I was dealing with patients who had like strokes, falls, amputations, spinal cord injuries, brain injuries, etc. And it was probably one of the best experiences of my entire life. Because it's one of the only spinal rehab centres in Victoria, it was really eye-opening and challenging to work within that population, but also really rewarding. I also find that pretty much everyone struggles with transitioning from high school to uni. However, after like the first semester, you really do get used to it. And I found that making friends with the people in my cohort was really important as they're going through like exactly the same thing as you. But yeah, that's pretty much my sum up of my time at uni.
Awesome. Thank you, Amelia. And thank you all for those introductions. We'll now move into the Q&A session portion of this morning. So Maisie, we'll start with you. What sort of assistance is there in regards to preparation and training for the challenging and potentially traumatic sides of paramedicine?
So definitely there are traumatic things that you will see as a paramedic, and you get exposed to them quite quickly on placement, but it's really good. I've been lucky enough to make a really good group of friends at university, and I live with a couple of them in the past, and we're really open and be able to communicate with people. But in class, we do have those moments after placements, after like big block placements, where we all sit down and we're like, okay, what did we see? How did that make us feel? And especially on road, after going to quite an intense job, you are able to talk to the paramedics that you're with and have been assigned to, and they'll talk it through with you, make sure you're okay, and give you some resources to go talk to if you need to.
Awesome, thank you. So Jess, we have a question for you. Can you specialise in an area of physio at Monash?
Not at Monash. So the degree that you enter into at Peninsula campus is a general degree. So by the end of that, it allows you to go and practice as a physiotherapist. After the degree, however, usually after you've got a few years of clinical experience, you can go on to specialise, but that's not through a university specifically, but rather through a college of physiotherapists. But yeah, main point from that is that the physio degree at Monash is a general degree.
Awesome, thank you. Amelia, what do OTs do and what are the differences from physiotherapy?
So OTs help people to participate in the activities of everyday life that can be impacted by like disease or whatever. But we do that across like physical, psychological and social health. And the only similarity we have with physios is that OTs can specialize in upper limb therapy. So we do have to know like detailed anatomy and physiology of the arm and do physical assessments and interventions. But that's like kind of the only limb that we deal with, and physios deal with the rest.
Awesome, thank you. So Maisie, what other career options are available for paramedics?
So definitely there is just the paramedic degree, so you can just become a paramedic, and everywhere in the world needs paramedics, like from the UK to Australia to Darwin. But other than becoming a paramedic, there are a lot of non-emerge paramedics out there, so not as high acuity jobs, and they're really good jobs. And I've been on a couple of placements with non-emerge and they've been really, really good. Apparently at the moment in Melbourne, they're looking at putting paramedics and people with paramedicine degrees into the emergency rooms, and that's a new developing job that they've got going on at the moment. And also personally, I don't know if I want to go into a master's and go into some research with my degree, or I'm also thinking about also becoming a nurse afterwards, but I'm not sure. It's what you make of it, really.
Awesome. So Jess, in physio, what proportion of contact hours are lectures and tutorials?
There's quite, I would say, an even mix of lectures and tutorials. Tutorials are more, we call them pracs rather than tutorials because they're quite a hands-on thing. The contact hours, I guess, unlike other courses, you have all your hours given to you. You don't get to pick and choose when your hours go. So that's probably the main thing if you're thinking about studying physio, is that you've got a set timetable with very little room to move within that. And it's 5 days a week. Some semesters maybe 4 days a week, but generally 5. And there's about 20 plus contact hours a week, plus private study. So it is quite a full-on degree with the contact hours. But in saying that, there's still plenty of room for things like social sport and work as well. But in terms of the proportion, say on a Monday, you'd have a couple hours of lecture, and then the afternoon you'd have an hour or two of prac, depending on what year you're in. So a good mix each day of prac and lectures.
Awesome, thank you. So Amelia, how physically demanding is working in OT as a career and also in the placements?
So OT isn't a too physically demanding job. It just depends on what you go into, I guess. When working in hospitals or rehab centres, when manually handling the patients, you have like equipment that helps you and also kind of manual handling training. But I would say that the biggest physical toll OT has on the body is just like running around the hospital all day.
Awesome. So Maisie, another question for you. Where do you go on placement? So is it only on road or do you also get hospital placement?
So personally in my second year, I've only done two-week placements with Ambulance Victoria, and then I did 10 non-emerge placements, which were just day placements that were scattered throughout my first year. Personally, though, I haven't actually gone on hospital placement yet, but I hear they're incredibly good and that it's a really good learning curve to go through and go to the hospital placements. But yeah, personally, I've just gone on road at the moment.
Awesome. So Jessica, where do you get to go for physiotherapy placement?
There's quite a broad amount of hospitals that physios can go on placement. You don't get to choose where they are. The university picks those for you. But in saying that, you can put in preferences. For instance, if you live rurally like me, you can put that you prefer to have a hospital nearby for one of your placements, which is what I'm currently doing. I've got the placement at Traralgon Hospital, which is just awesome. So I can live back home But yeah, hospitals around Melbourne. There's also the option to do placements in Tasmania, which I've applied for as well. So yeah, quite a broad spectrum of hospitals. I think also in fourth year you get to pick an elective, and there may be some option to do private practice, but again, the university mandates and facilitates which placements you actually go on.
Awesome, thank you. So Amelia, is there an option to do pediatric placement or a specialist pediatric subject?
So within OT placements, they tend to want to give every student variety. So like you'll likely get a mix of placements such as like rehab, mental health, community-based or schools. And you can't pick and choose your placements. And there's also no specialist pediatric subjects. But however, in our core occupation unit that we do scenario-based learning, every semester we'll focus on at least one scenario in pediatrics, whether it's like developmental disorders or autism, etc.
Awesome. So Maisie, what advice do you have for someone considering a career in health?
Well, advice, I'm not very good at advice, but I definitely had this moment when I was quite young where I was like, I want to be a paramedic because one of my family friends needed an ambulance, and I sat in the ambulance going to hospital with her, and I was like, this is what I want to do. And the paramedic seemed so cool. I was like, I want to be a paramedic so bad. And I really did weigh it up for a while though, because I was considering studying science at Monash, and I did think about it. I was like, am I a people person? Can I deal with being able to see all those kind of scary scenes and be put on the spot like that? And I did consider it for a really long time, being like, oh, maybe I should just be a scientist. But no, I persevered, and I'm so happy that I did choose to do paramedicine because it has been an incredible experience so far.
Awesome, thank you. So Jessica, are there any elective units in physiotherapy?
No, you generally no. You, like I said previously, the course has set subjects that you have to do. So it's unlike other subjects where you get to pick an elective unit of, say, French or something else. You're given set units that you have to complete as to graduate as a physiotherapy and then be able to practice as a physio. However, in saying that, there is some option in fourth year to have some say on what elective placement you get to pick, but otherwise you are given what you get.
Awesome, thank you. So Amelia, what career options are there for OTs?
So OTs work in a range of different areas that can include like hospital and acute care. So we can work in like the emergency department, neurology, mental health, pediatrics, palliative care. We can be in rehab. So like, again, like palliative care, neuro rehab, people with brain injuries, spinal cord injuries. There's also private practice, so that's mostly like pediatrics, people returning to work or returning to driving. And then there's a lot of like community jobs where you're working within a community. So you're looking at things like disability or like community access and like modifications and accessibility for buildings.
Awesome, thank you. So we have a question here for Maisie. In paramedicine, how much time is spent doing practical components over theory?
So far in my first year, it was only just one unit a semester that it was more practical, and the rest were kind of theory based, like learning the theory of the body and biology and everything, which I personally didn't enjoy that much because I'm terrible at biology. But yeah, it's pretty much 3 hours a week you'd be doing a practical component, and the rest were more theory based. But then going into my second year last year, because I was only studying part-time this year, it was there was 2 units where it was more hands-on practical stuff, which was really, really good, and it was really intense, and you had to learn a lot and pick it up quite quickly, but it was definitely a good learning curve, and yeah, definitely excited.
Awesome. So we have a question here for Jessica. So what are some of the key skills or traits that you have learnt through your physiotherapy course?
I think massively learning how to talk to people and listen to people as well. Listening's been such an important skill that I've developed, which now that I'm on placement, I'm really seeing how that gets to affect other people's lives. But also problem solving, because you're given this patient and you may or may not know what condition they have, or you may know their diagnosis, but there may be this other symptom that's not quite making sense. So you get to sort of problem solve and work with the team at the hospital to try and that best approach to the patient's treatment. And then even with, say their condition, but this treatment might not be working for them, you have to figure out why that is. And it's quite fun to have that problem solving. So that's probably one of my favorite parts of physio as well, as the problem solving. But yeah, also the communication and the listening that you learn to develop as well.
Awesome, thank you. So Amelia, what advice do you have for someone considering a career in health?
My advice would probably be to just kind of like take everything in. Like at the start, it might seem scary because there's such like a broad range of stuff that you have to look at within health, and it can be like quite scary. Like, oh, I don't know what I want to go into. But just take time to kind of like research and not get too overwhelmed with kind of everything that's chucked at you, probably.
Awesome, thank you. So back around to you, Maisie. So what is the most exciting or rewarding thing about what you're studying?
Definitely either the practical units or going on placement. Like the practical units, really sets you up to go on placement. Like you go outside a room, it's kind of like, thank God you're here, and like you've got a 65-year-old male with chest pain, what are you going to do? And you walk in and you're like, okay, I'm a big boy paramedic, I can do this. And then when you get on placement, then you get to actually run the jobs. And probably the most rewarding part about the whole thing is making a change in someone's life. Like I remember going to a case and it was CPR and there was a resuscitation and someone was okay, and just to make that change and take someone from the brink of death was definitely the most rewarding part of the whole experience that I've had at Monash so far.
Awesome. So Jessica, what advice do you have for someone considering a career in health?
I would say research which area of health, whether it's OT or paramedicine or nursing or whatever area of health you're interested in. Definitely researching what it's all about. And I would 100% recommend doing work experience if that's an option for you while you're in high school. That's where I sort of discovered that, yes, physio is what I want to do, because I was also tossing up occupational therapy as well. But then physio was, where it really drew me in. That work experience was the thing that drew me in. And then just enjoying your studies in year 12 and in high school, so that you can then get to the point where you are happy enough to then continue studying, because it is quite a lot of content for in health degrees. So I guess enjoying studying and building good study habits earlier on will certainly help you continue that studying through university.
Awesome, thank you. So Amelia, what is the most exciting or rewarding thing about what you're studying?
I think it's the ability to change people's lives. On my placement last year, I retaught a person with a spinal cord injury. It was quite high up, so they had quite limited use of their hands. I taught them how to be able to pick up a cup again and lift it to their mouth. So I literally taught them like how to drink again, and it literally, like, that placement changed my life, and that's why I love OT. Like, it's so rewarding.
Awesome. So Maisie, what's one piece of advice you'd give to a high school student wanting to study paramedicine?
Oh, advice in year 12. I wish I could give myself advice in year 12, because I was terrified. I didn't know what I was going to do. I was so scared about everything, but I really wish I was able to tell myself to just sit back, relax, just let life take you where it was going to take you. And I was really panicked about studying paramedicine, but it forms around itself. It's a massive learning curve, but you'll definitely get there.
Awesome. So Jessica, what is the most exciting or rewarding thing about what you're studying?
On placement, I'm dealing with stroke patients and patients with knee replacements and all different things. And similar to what Amelia was saying, I've got a stroke patient, and you may think, walking, you take that for granted, but I've got a patient who, can't walk, and you get to watch them take their first steps and move a finger for the first time in however long. And that's just the coolest thing, because their face just lights up, and you're the one that gets to help them with that. So it's just the coolest thing, and yeah, I love seeing people smile as they realize what they can now do and continue to develop. Once they get that finger moving, then they get other fingers and then the hands, and then it all starts to come together. So it's just really cool.
Awesome. So Amelia, what's one piece of advice you'd give to a high school student wanting to study occupational therapy?
I tell them to kind of research as much about OT as they possibly can, because before I started like OT, I had no idea what it was about. I feel most people don't know what it's about. It's like, oh, do you help people find jobs? It's like, no, that's not what occupational therapy is. But just because it means kind of something different to everyone that studies it, so finding like the personal meaning of like OT to you is kind of like important in your like journey as an OT.
Awesome, thank you. So we have another question here for Maisie. How physically demanding is paramedicine?
It's definitely a bit physically demanding. Back in first year, you have to do a fitness test, which I struggled with because I'm not the fittest person, but I've definitely worked on it since that fitness test where I couldn't get past a 60-second plank, which was a bit embarrassing, but that's okay. Other than that, it is physically demanding. You definitely have to work on your fitness and everything like that. And going on placement, you get thrown. Being the student, you get to carry all of the bags because the actual paramedics, they just walk in without the bags. So you're carrying all the bags for them, and you've got to be able to lift the bags and the oxygen bags and all of that things. But also there's a massive thing of just protecting your back and protecting yourself. So you need to be able to know when you should not lift a patient and when you should be able to lift a patient, kind of thing.
Awesome, thank you. So Jessica, what made you choose Monash?
In I think it was year 11 or 12, my high school went and took me to the open day at Monash. And I got a tour of, I didn't actually get a tour of the Peninsula campus, we went to Clayton, but the vibe I got from the staff and the students that were there at the open day really sold it to me. I'd been on other open days to other universities, and nothing felt quite like home compared to Monash, even though it was the first time I had been there. So it just felt like a really friendly, welcoming environment, and just there's so many options for you of things that you can do on campus as well, like all the sports and you know, things like other clubs. For instance, I went to the Gold Coast to compete in rowing for my university. So there's the academic life, and then there's the social life with bowls and the sports, and even just hanging on campus in a friendly environment where the staff members will walk past and say hey and start having a conversation. So yeah, just the environment, the atmosphere of it really is what drew me in.
Awesome, thank you. So Amelia, what made you choose Monash?
So at the time I was applying for Monash, I was actually living interstate, so I couldn't go to any open days, and basically had to do all my research online, watching videos about like the campus and like OT and Monash as a university. And I just the level of like professionalism in like OT like as a profession was really like important to me, like for Monash, and they are like some of like the best OT professionals and like the highest in the field. And also Peninsula campus like felt like small and safe to me. Obviously compared to like Clayton and Caulfield, it just kind of feels like you're in your like own little home, and you like know a lot of other people that are there, so it doesn't feel like too scary.
And how about you, Maisie? What made you choose Monash?
I did go to the open day, and they like the paramedics that were there, or the paramedic students that were there, and the staff that were there, they really sold it to me. It did feel like the other girls were saying, it did feel really safe going to Peninsula. It is such a lovely campus, and it's surrounded by beautiful trees and birds and everything. That really sold it because I am from rural Victoria, and I was like, this is home, just on the other side of the bay. And that really sold it to me as well. And yeah, I just love Monash. It just, the blue, I don't know.
Awesome. So thank you very much. We're now coming to the end of our session. So Maisie, Jess, and Amelia, thank you so much for sharing your career insights with us. And thank you everybody for joining us today. I really hope this gave you a taste of where a degree in paramedicine, physiotherapy, or occupational therapy is like at Monash University. If you think that these courses could be for you, make sure to visit our booths and have a chat with our staff. We really hope to see you on campus soon. Goodbye and stay